This video is about experience of working as a veterinarian. My guest, Magda Lewandowska, studied in Poland and then moved to the UK and worked there for quite a while. Hopefully, this conversation is going to be useful to someone considering taking that profession. In that case, the information might be useful to prepare you better to the challenges of this work. Or maybe you're just generally curious about the topic. Was interesting for me. Hopefully it's going to be useful for you as well. Thank you for agreeing to talk to me. I wanted to ask you about your experience in your profession. How did your education go? What did you like there? What you didn't? What proved to be useful? And what was some waste of time? And whether you know about any differences between education in different countries. I assume that you studied in Poland and then moved to
Poland,
the UK.
Yes. Mm-hmm.
So let's start with the education. How long does it take to become a veterinarian?
5.5 years.
Does it involve... I'm not familiar with how doctors actually learn. I know that after education they have some kind of internships or something like that. Yeah. Is there something like that for veterinarians as well?
Kind of. I mean, I graduated 18 years ago, so maybe something's changed. When I studied, it was the first 2-3 years, it was mostly theory, so, you know, anatomy, physiology, pharmacology, pathophysiology, and all this stuff. And then the last kind of 2.5-3 years, it was the clinics, so, you know, surgery, I don't know, internal medicine, this sort of stuff. And as far as I know, like when I studied in Poland, I had to like do everything. So small animals, large animals, exotic animals, insects, including bees and I don't know, silkworms and stuff, as well as like meat hygiene and all these like milk hygiene and slaughterhouses. As far as I understand, in UK, for example, you kind of specialize early and you just do like small animals or large animals, farm animals and stuff like that.
Okay.
And I mean, which is kind of, from what I understand, the reason why Polish vets are so popular in UK, because we are qualified to do slaughterhouses. And yeah, that's now after Brexit is a big problem because there's no vets to work in slaughterhouses.
I assume that people being familiar with multiple areas is always useful. Specializations are definitely helpful, but there is always some need for people that are able to merge different areas between between themselves, and for that you are supposed to know at least basics of what happens in each area. Was it your experience as well, or was it specific to slaughterhouses?
You know, for me, when I was studying, one thing I realized very quickly is that you don't really know what it is to be a vet until you start studying to be a vet. And I think they start in human medicine as well with the how is it called, the place when you do postmortem in
something like theater, something? I'm not sure.
No, it's like in a mortuary. You start in the mortuary, so you basically just deal with dead bodies, and that can be a shock to be put in front of a dead horse or a dog and have to dissect all these muscles or nerves and bones and stuff like that. And for me, this is what it was, like the different kind of aspects of veterinary medicine. It's more a matter of, seeing what it actually is, if there is anything interesting in it or not. So when I was kind of studying, I don't know, I had this vision of being like orthopedic surgeon, but then as I started like trying on with the bones and stuff, I realized that it's completely something that it's not even that I'm not interested in it, I just don't understand it. It's just too stiff. I'm quite decent with soft tissue surgery, but the orthopedic is just something my brain and my hands don't understand. So I think it is useful to try it on, so you realize, you basically see if it's something for you or not. More than kind of, yeah. I mean, like, I don't know, when I graduated, I think if you gave me a horse, I could maybe be able to treat it, but now 18 years down the line, I wouldn't even know where to start with treating a horse. So, the fact that I had training, it doesn't really necessarily mean that I can do it.
Well, I had a degree in physics at some point. I definitely wouldn't hire myself to be a physicist. I understand that you have to practice your skills for them to stay relevant, so no wonder there. You mentioned that it was surprising for you, all these aspects, like getting in front of all dead animals and then not really understanding orthopedics before you starting doing that and such. In hindsight, could there be anything to help you to prepare for that? Was there something that you could have explored prior to joining a university, university for this profession?
I mean, you know what? Like, I think that the biggest problem veterinary medicine has is that you know what? It's a little bit like the problem with becoming a mother, because the narrative around being a mother is that it's all beautiful and this pink baby and everything is so sweet and you're going to be so fulfilled and stuff, and then you give birth to this child and you're left with this child, and suddenly it just turns out that it's like, I mean, there might be moments when it's all lovely and sweet, but most of the time is like, sleep deprivation and self-doubt and being tired above like anything you have ever experienced. So with veterinary medicine, the narrative for, non-veterinarian is that, oh, you love animals and it's puppies and it's all amazing and, you're going to be helping like animals and stuff. And then you go into this job and it turns out that it's, like you do help animals, but it's, I'd say, I don't know, maybe like 20% of what you do. And everything else is really dealing with people, and on a level that is extremely difficult, because the people that we see, I mean, mostly veterinarians, with exception of like, like the routine veterinary work like vaccination or stuff like that, but we do see people in a lot of cases on one of the worst days of their lives. Their dog has just been hit by a car, or the cat is like been diagnosed with untreatable terminal disease, and we just put in a situation when we have to deal with it. So we have to like diagnose the animal, figure out how to help it, or how to at least, alleviate the suffering. And then we have to deal with the human kind of side of it, where, the owner of the animal is quite often they understandably are in very emotional state. They worried about, what's going to happen, how much is going to cost, will they be able to afford it, can they, I don't know. look after this animal after, you know, some surgery or something. So, and we are not prepared for that. Like at the university, at the veterinary school, we're not prepared for that. And then you have the other side, you know, so we have the owners in front, the patients in front of us with their owners, and behind we have the managers, you know, the owners of the practices, and all the kind of money side of it and administration side of it. And yeah, nobody really prepares us how to deal with it. So you have a situation where, you know, people just burn out. And there is a very good reason, like, I don't know if you're aware of that, that, like, you know, just by the sheer fact that I am a vet, I'm like 3 or 4 times more likely to die of suicide, like, with nothing else going on. So there's a very good reason for that, because it's a difficult job. It's a really difficult job.
I've never heard about that statistics. Do you know if there is something similar for doctors, or is it even worse for
dentists? Dentists are more likely to commit suicide. I'm not sure why. But yeah, generally, yeah, doctors, but veterinarians are more likely to commit suicide than regular doctors, obviously far more likely than general public, and almost as likely as dentists.
Do you know if you probably talked about this with your colleagues in the UK that have different that have had education in different places, in different universities? Was their education different from yours, and did it prepare them better for all these complications with patients, with their owners, and with the management? Because I've talked to other people about their experience, for example, about education in the difference in education in Russia, Israel, Switzerland, for example, and there are differences, and there are some moments that are better in one country, some moments that are better in a different country. Do you know if what kind of things would you add to your Polish education to make it more relevant and better, again, based on your experience, and what from what you saw from others with education from different places, and what parts of your education were missing from education received by others in your practice?
And now, when I was graduating, I mean, my kind of way of becoming a vet was not that usual, because through the whole time when I was studying to be a vet, I also worked as a veterinary technician. So kind of I was going to the uni to study, and then I got trained on the job by, you know, vets with whom I was working at the time. And that is one thing that you know, even if you ask me like 20 years ago, I would tell you straight away that hands-on experience is something that was not taught at the veterinary school that I graduated from. So basically, you know, it is absolutely, at the time when I was studying, I don't know how it looks right now, it was absolutely possible to become a vet and don't know how to do injection.
Is it the same with the UK education, for example?
In UK, from what I understand, you have much more kind of hands-on clinical experience. So you have to go into like a veterinary practice for a period of a time. I don't know how long this period it is. I think it could be like a month or something like that, maybe more, where you just like shadow veterinarians in like a normal veterinary practice. And you know, like when I worked with veterinary students, I would always make them do something. So, you know, do injections, place intravenous catheters, you know, stitch something up, and I presume that all of my colleagues will do the same. So presumably vets who graduate from UK universities will kind of have the practical skill. However, I still see them, the new grads, coming out of veterinary schools and completely not able to cope with clients, with the kind of, the psychological kind of aspect of being a vet. There is one thing I'm kind of going to mention. I have tried, after, you kind of, we agreed to have this conversation, I have tried to explore this topic, but I didn't really go very far, because there is this thing, since I graduated, veterinary medicine, like the whole medicine overall, changed quite a lot, and nowadays we are supposed to be doing something that is called evidence-based medicine. And evidence-based medicine is a kind of a way of making clinical decisions that include the kind of scientific evidence, but also include the, values of the, obviously in the case of veterinary medicine, like the owner of our patients, because the patients for vets are the dogs and the cats and the horses. And in a case of human medicine, the values of the patient. So how it looks, we should and I'll just give you an example. Following the evidence-based medicine, let's say that you have a dog in front of you that has like a bleeding abdominal mass, okay? So, back in the day, the vet, in the old style veterinary medicine, the vet would kind of either decide, oh, we have to operate, or decide we have to put to sleep, yes? And it would be the kind of doctor, the vet's decision. Well, nowadays, which I actually wholeheartedly agree, what we are supposed to do, we are supposed to say, listen, to the owner, listen, your dog has this bleeding abdominal tumor, and say, for example, that, following basing on what we know statistically, your dog has 75% chances of dying within next 6 months, regardless of, even if we operate and give chemotherapy, because 75% of these tumors are hemangiosarcomas. And then, obviously the 25%, the dog has a good chance of making it if we operate. So that's the estimate for surgery. That's the data from the kind of evidence, scientific evidence that is available, and then the owner of the patient makes the decision. However, I am actually not convinced, I'm really not sure, whether the principle of evidence-based medicine are actually explained to new grads, because what I see a lot among the modern veterinary, current veterinary kind of trends, I suppose, is that they all want evidence for everything. So, they say, let's say you have this dog with the bleeding abdominal mass, and instead of having the conversation with the owner that I've just presented to you, the conversation would be, oh, your dog has abdominal mass, I don't know what it is, we need to do a biopsy and get evidence. So we can make, decision basing on evidence, which for me is crazy. And I just don't know if this kind of principle of evidence-based medicine are presented or explained enough to new grads. And I'm not convinced. I'm actually, I'm 100% sure that the managers, the non-clinical kind of people who are involved in running veterinary practices, at least the ones that I work, they have no idea what evidence-based medicine is. And that can create a lot of tensions and a lot of problems as well.
First, a small clarification. When you say this evidence-based medicine, you do not mean that it wasn't based on science before that. you just mean that now it's not you making this decision based on this science, but you let the owner of your patient to do that.
Yes, yeah.
As for the inability of these newly graduates to make this decision and willing to get more tests and such, is it because the regular problem that it is hard to make a decision based on incomplete data, and you never get complete data, so you just have to take risks and make some decision based on whatever you see, and it's not something they are familiar with, and they think that everything can be clarified, and if you put enough effort into something, you can figure out everything, and then you can make a perfect decision based on that.
Yeah, but I mean, you know, the truth is that it's very rare to be able to make a perfect decision, especially in veterinary medicine. So, maybe they are just not trained in how to apply evidence medicine in practice. That could be the case as well. So they keep looking for this evidence to present to the owner, and it just, So, I mean, you know, being a vet is really, really hard. It's really, really hard. Because you work with patients who don't talk to you, who, you know, a lot of symptoms that you have to analyze are described to you by people who don't always use proper words for that, which is absolutely understandable, because, you know, like if you don't have any medical background and you see that your dog is doing something weird, then you will call it a fit, for example. While for me, you know, it's not a fit, it's something else, or might still be like a seizure, like an epileptic seizure, but it could as well be something else. So you have a patient that doesn't speak, you have owners that don't necessarily kind of report the symptoms that they observed in an accurate way, and on top of all of that, you have like 10 or 15 minutes consultation time, and you are expected to, you know, put it all together and come up with a diagnosis, or at least differential diagnosis, and, you know, explain everything to the owner. And let's not forget about the whole kind of reality shows that the television is putting out now about vets, that just make it even, like, you know, the people come in with completely unrealistic expectations, you know, that it, not even like, you know what, not even reality shows, like just generally the whole television, you know, you see any kind of medical drama and you see these poor doctors just having no social life, no life-work balance whatsoever, you know. They, for some reason, they called in on this TV series, what was it, like, I don't know, it was Grey's Anatomy or something, that, you know, you were supposed to come to work when you drank or you on drugs, because, like, this is just crazy, you know. So, you know, the people come in, and I have heard very often that, you know, like, apparently I'm supposed to have nothing but veterinary medicine in my life. I've heard it from managers. I telling them, listen, you know, I need to go and pick up my daughter from the childcare. But what about, and the managers, yeah, but what about this dog? So I'm supposed to, like,
oh, this is
between
probably
my child and a dog, I'm supposed to put the dog, like, come on, really?
Well, this is probably not specific to treating animals. It's probably how businesses work in different areas, because everyone wants you to work as much as possible, and I assume that in medicine, where people get treated, it's somewhat more regulated. I have no idea. I just assuming that it has something to do with. I would again think that if doctors are getting mistreated, they get distracted, they get annoyed, they get tired, and they start making more mistakes, and these mistakes are more costly when you treat people. And then maybe it helps with getting better work conditions. I'm not sure if
I don't think it's the case in human medicine either. There's this book. It's written by a doctor. I think it's called "It's Going to Hurt," and he does describe like these crazy 24-hour shifts, which I mean, I did do 24-hour shifts as a vet, but it's not a standard. The standard veterinary shift is like 12 hours or 14 hours, and you're supposed to just show up and do that, no lunch break, no nothing. But I'm not going to lie to you, vets do it to themselves, and I was, back in the day, I was also like convinced that unless you don't eat and you don't sleep, you're not doing it right, which is insane. And there is a culture, hopefully, something's going to change, because doctors are they're striking in UK right now, because you really cannot be expected to just give yourself to work all the time at all days, it's just crazy.
I'm familiar with this approach that you have to be some kind of hero all the time at work, and you are supposed to sacrifice yourself and your life and your relatives to your job and so on. I understand that this is I understand roots of that in the post-Soviet states and states that had been under Soviet control, because the whole narrative there was that your life is for the country
life
and such.
Life is for the country, yes.
Is it the same with the UK? I understand that businesses definitely would want you to sacrifice as much as possible for these businesses, but generally I assume that the country has different culture. So why it works like this from your perspective in the UK?
You see, I absolutely do not know. I've been trying to understand it for a really long time, and I've been trying to understand why did I buy into it as well. But I just don't know. I think that like when you work, because like a lot of vets work in small teams, yes. So you have a vet, you have a nurse or two, and you have, if you're super lucky, you have a receptionist as well. And then you come to work, and then people start calling, and it's just like whatever calls, you're supposed to deal with it, yeah. So it's not that you don't, like, you do have appointments, but you also have a lot of people that walk in from the street, or emergencies and stuff, and you're basically supposed to deal with what's in front of you during the day, and nobody questions that. And then I think that, I don't know why no one questions that, but when someone questions that, they are basically just presented as the ones that don't want to support the team, like, we are the team, we have to, like, we get through it, And then the thing is that, and I think it could be with doctors as well, a very particular type of people go to study veterinary medicine, yes. So we are, we are, a lot of us are not very, we are geeks. We don't have a lot, I mean, we do have some social life, but we are very, like, we spent our childhood studying, we are used to kind of the whole school system. So the whole school system is that, you put the effort, and then you get a grade, and then the grade is good, so then you kind of get rewarded for your effort automatically, like the reward is written into the system, yeah. So then you graduate after, like, I mean, in order, it's not like, obviously it is like 5.5 years old to be a vet, but before you kind of go to veterinary school, you have, like, I don't know, 12, 16, whatever years of primary education and secondary education and this and that, and then you come out in the world at the age of 20-something years old, and you have this thing in you that, oh, if you only try hard enough, it's going to be okay. Because the system rewards you, because this is how you function through the whole education process, yes? You put the effort, you got the grades, and everyone was happy, and yeah, you know, kumbaya. And then it turns out that you come out in the real world, and people take advantage of you. And there is no reward. Like, you know, if you do a good job, your reward is that you get more job to do, basically. So it takes, I think, a lot of time for some kind of, you know, something to switch in your brain and realize that you're actually killing yourself. Yeah, you keep working harder, doing more, being more efficient, taking on more responsibilities, and you've got nothing out of it, you know? You know, your salary is not bigger, you don't have like a better position or anything like that. It's just still the same thing, and this is when people burn out, and this is where people you know, go part-time or quit veterinary profession altogether. And there's also the thing that, you know, like majority of vets are females, so, you know, we graduate, we might even be meeting our husband while studying, you know, at uni, and then after a few years we decide to start a family, and we, you know, go on maternity leave and, you know, come back or not. So yeah, so like lack of role models is also a problem, yeah, because the vets that stick long in this profession full time, like I, for example, I've never really worked part time. I've always worked full time. There isn't a lot of, like, for example, females like me who will, you know, stick at this job full time. I didn't really have any role model as a vet. I had to like model how to be a vet, you know, past these like 5 or 6 years after uni, because yeah, a lot of other female vets will get married, have children, you know, come back part-time or not come back at all. So the vets who stay long-term in the profession are fathers who have wives at home. You know, they can afford to put the hours because they don't have to deal with anything else. So I don't know. It's just all. I think many factors that contribute to that. But I don't really know if I've never been able to like put it down to like one particular thing, and that, oh yeah, this is that's causing it, and if we change it, then everything will be great. Yeah.
And a part of it is probably that you value someone's work if you see someone struggling to perform that work, and you don't see how much struggle there was prior to that work, during the education, during getting all this experience, and you kind of learn that, and you start acting accordingly. You start not demonstrating a struggle that is not real, but you start driving yourself into the mode where you start struggling, so people around would probably see that.
Yeah, because you see that for someone else it's easy, and for you it's not easy, so then conclusion is that there's something wrong with you, you have to try harder, and it's just not working,
That was one of the interesting moments for me back when I joined Google. The company still has plenty of positives and unfortunately plenty of negatives. One of the things that did look interesting is that we were told from the very beginning that we are not supposed to be heroes, that if a job requires some kind of heroism, it means that something is wrong, and the job has to be adjusted. Some additional tools have to be created to make it more sustainable, in the sense that you would be able to perform the job long enough instead of just burning quickly through your resources. Ultimately, it's not what the company values and incentivizes, unfortunately, but it
All
was
right, so they put it in a policy, but they don't actually apply it.
Oh, there are many things like this, but
Yeah.
I mean that it was an interesting thought for me because it was the first time someone at a company told me that I am not supposed to fully sacrifice myself for the company, and this thought was so unusual, but ultimately, yes, it led to some better understanding of how to perform my job and how to organize things at the workplace, for example. That again, it's way better to look at what makes job harder for you and for others around, and try to design some ways to make things easier, because then it might require more effort short term, but then it's way easier for everyone long term. Unfortunately, many businesses don't care about long term benefits for various reasons. They want short term things.
Yeah, so it's like, you know, like right now we see it very well the last, 10, 12 years in UK, the veterinary industry is being absolutely taken over by corporations. And you just see it so much, because back in the day, you know, when there was like mostly private practices, maybe like a small like, you know, network, like, you know, the owner would have like 2 or 3 branches of a veterinary practice, but you still you were able to talk to the owner like with a human being. And if you were lucky that the owner of the practice wasn't a psycho, then, you know, you were able to come up to some solution that would be beneficial for both parts, yeah? But nowadays you don't, I mean, you know, like the corporation, the boss is just high up in the sky, you know, you never get to speak to the owner. And the people that you speak to are managers who are given completely different goals that your goals are, yeah? So, like, I naively, when I started to, nowadays vets in UK don't even have a choice. We, you know, have to work for corporations because they are everywhere. You know, my understanding of manager of veterinary practice is that the job of manager of veterinary practice is to clear up the path so the clinical staff doesn't have to worry about anything apart of doing clinical work. But it turns out as not the case, because the manager, you know, gets like some, you know, goals like, I'm not joking. I am absolutely not joking. I worked for a corporation when we all had training from the DIE, yeah, diversity, yeah, inclusion, and we are all told in UK that we are not good enough because we are all white. And I mean, like, how am I supposed to meet the goal of not being all white?
Are there enough people coming from other countries to the UK to satisfy those quotas?
I don't think so, because, like, you know, for example, there is a lot of medical professional in UK from Asia, but they all treat humans. You know, like, I don't know why, but most vets in UK are looking like me, you know, they have a low amount of melanin in their skin, and I don't know what can be done about that. I don't know, but apparently it's a big problem, and we're not good enough because of that.
A small question, and I'm not asking about details, but do you know if your salaries, your compensations are about the same as with doctors that treat humans?
Not.
Okay.
Absolutely not.
Which might contribute, because it makes it more worthwhile probably for someone from other countries to move to the UK. if
Of
they
course,
treat people,
yeah.
but
Yeah.
doesn't make much sense for this move if you treat animals.
If you treat animals, yeah, absolutely, absolutely. So yeah. So I don't know what I can do. So if my problem is that I need help because my clinical workload is so big that I don't cope, and to that, the manager's response is that I'm not diverse enough. Then how are you supposed to reach a understanding? How are you supposed to solve the problem? I don't know.
Talking about the coping and getting back somewhat to this statistic about suicides with veterinarians, is it something new, something changed recently there, or do you mean that people in the past were as tired and as overloaded as now? I just assume that if this problem has been there for quite a long time, then some kind of solution is supposed to be there as well. At least someone was supposed to think about some solutions. It's not always reasonable to expect some solutions to problems that are pretty new, because it takes time to develop some solutions. But if it has been like that for a while, what do you think? Is there lack of possible solutions? Is there lack of willingness to implement them? Are they too expensive? Like, I assume that reducing workload, introducing different shifts so people would have a chance to get proper rest, adding some help with people, like you mentioned, if you're lucky you have a receptionist. So maybe not a receptionist, but basically someone who is better at dealing with upset owners and such, to take that load of you. I understand that it requires hiring yet another person, so it's another expense that companies don't want to take, but it would at least solve the problem and make it more sustainable and such. So what's the reason for it being the way it is?
Now, I think it's like from the employers, so mostly corporations in UK, the problem is dealt by putting us all through mental health training, where we are all told that we should be mindful and doing more yoga and read books and take a bath, and which obviously doesn't change the fact. I mean, when you've just been through like 12 hours shift at the vets, yoga's not going to solve your problem. It's just not going to solve your problem. But the managers tick the boxes, and as far as they're concerned, if someone decides to commit suicide, is not their problem. The vets have been taking the things in their own hands, so there is many kind of grassroots organizations that are supporting, they're basically trying to support vets as much as possible, which the biggest one, and I think most effective one being Not One More Vet. They at this stage is like international organization, and I have been lucky enough to be able to use their help as well when I was going through my burnout. We kind of trying to address it. I mean, in UK, Royal College of Veterinary Surgeons, so the organization that kind of supervise veterinary profession in UK. They looking into it, but it's the same old problem. Yes, so they have a press release that they are opening inquiry, and nothing really comes out of it. I don't know what the answer is, because more staff, more support, it will solve many problems, but it wouldn't solve the, one big problem that veterinary medicine has, which is the cost of treatment. So we basically, now I absolutely understand, imagine you walk your dog and your dog gets hit by a car, and then you rush to the vet and you're told that the whole thing is going to cost you £3,000, yeah? So it's obviously you are upset, and obviously, even though at some level, it's not the vet's fault, like the vet that is standing in front of you, somebody else set the prices, but I absolutely understand that these people are just like, what, and I have to deal with it, with the upset. For many years, pet insurance was our option to go around it, but nowadays pet insurance is just completely going down the drain because they not as good. The insurances are not as good as they used to be. I don't really like this word, but I've got to say, veterinary industry has a big systemic problem.
This insurance.
The whole thing, there is just I don't know how to solve it. I don't know, because again, hiring more staff will help, but who's going to pay for it? Particularly nowadays, because back in the day, it was the owner of a practice, and that was pretty much the end of the food chain, yes? So we as the, on the floor vets, we had to earn our salary, and we have to earn the salary of receptionists and nurses and, the salary of the owner, and that was it. But nowadays, the vets on the floor, we have to earn our salary, the salary of the receptionists, of the nurses. We have to earn the salary of the first tier manager, the second tier manager, the third tier manager, and suddenly this money that we make on the floor treating the animals is just not going far enough. And that's it.
It's an interesting thought, because usually the argument in favor of some kind of globalization of creation appearance of big corporations is that when you bundle things together, you make same things cheaper, and then you are more competitive than small businesses. I've never thought of this. Probably there might be an argument that there are still people that produce some value in form of better marketing, advertisement, public relations and such,
you cannot, marketing and stuff is not really something that you can apply to veterinary medicine, because at the end of the day, if you're not a good vet, there's no marketing that can sell you. If you cannot fix the animal, what sells you as a vet is your reputation.
Well, as a person, yes. As a company, it's probably easier, because potential issues with one employee doesn't affect the business as much. As long and you can try to compensate.
But it's not like that. Do you have a dog? Do you have any?
No.
Okay, right. So when you have a pet, for example, you have a dog, you go with your dog to the park, and you talk about things, yes? And the other owners will tell you their experience at this vet and at that vet, and this is how you find a vet that you can trust, because it comes recommended, yes? Obviously, with a vet, there is a limited amount of practices you are willing to consider, because it's all got to be within a driving distance, yes? Hence, you have practices that are super busy always because they provide good service, and you have practices that might not be that busy, but what corporations can do with marketing, they can offer deals on vaccinations and deals on microchip, but they make up the money that they lose with these deals, they make up with something else. So the prices across the whole veterinary industry are pretty much the same.
Mm-hmm.
Yeah, so it's marketing, all this stuff is not really something that you can apply to veterinary medicine, because at the end of the day, what brings money is the owners who are willing to pay for the treatment of their animals. And there is only so many owners that are willing to pay. There is only so much money the owners are able to spend, not even willing, able to spend. And this is where we hit a wall where, big corporations, they might be able to get a better deal from the suppliers of a medicine, but it's really not making a big difference when you're looking at so many tiers of management that it needs to support. Yeah.
You mentioned that the insurance is not as good nowadays. Mm-hmm. Is it because it doesn't cover as much?
Yes. Yeah.
I understand that insurance is probably not the only solution to this problem, mm-hmm. but it's one of the solutions. And I live in Switzerland. Here, everyone has to have some kind of medical insurance. Mm-hmm. It's compulsory. Mm-hmm. And I understand that in different countries it's done differently, and in some countries medical insurance is a way to make money for mm-hmm. Companies that provide such insurances. Mm-hmm. I'm not sure, I cannot vouch for that, but I have a feeling that in Switzerland it's more like these companies just manage distribution of this burden. Mm-hmm. So it's not about making money on such insurances, mm-hmm. But rather just distributing costs to the whole population somewhat evenly. Mm-hmm. And there are concerns about that as well. Rising prices of health insurance with time, mm-hmm. Poor and rich people having to pay the same amount mm-hmm. of money mm-hmm. for this insurance and such. But at least it's some solution. Mm-hmm. Why do you think, and maybe you know something, why is there no progress with insurances for pets in the UK? Is it because these insurances were becoming too expensive and people were not able to afford them either way?
Yes, this is what it is. I mean, you can get a good insurance that will cover everything, but it's going to cost you. Mm-hmm. So, back, at the very beginning, because I came from Poland, and in Poland, when I was working in Poland, there is no health insurance there wasn't health insurance for pets. I don't know how it looks right now in Poland. So for me, the whole idea of pet insurance, pet health insurance was just absolutely mind-blowing. And I don't know, it could be me being biased that I came over and I was just like, wow, you have, health insurance for pets. Maybe I just saw it in in a too positive way, but I do not. When I started first in UK, I don't remember so many claims being declined, so many exclusions being put on policies, so many you have to the how's it called, the excess, so the kind of money that you have to pay when you make the claim keeps going up, So nowadays, once you make a claim for your dog's condition, a lot of insurance companies will just completely, exclude it from future problems. But again, you can get a good pet insurance, but it's going to cost you, and in a way, I do understand the insurers as well, because people take just more and more sick breed of dogs. The breed of dogs that are popular nowadays. I mean, all the brackets of the flat-faced dogs, bulldogs, pugs.
They all have genetic diseases.
Yeah, they they need to have at least not all of them, but at least 3/4 of them have to have, big surgeries in the first year of their life just to function, just to breathe. So
and
I'm not surprised the insurances will put, prices, because someone has to pay for it.
And please correct me if I'm wrong here, but just for listeners, my understanding is that this is because people value pure bred animals, meaning that animals that are very similar breed with themselves, and that is kind of like with inbreeding with humans when different kings were marrying their cousins and such, and if you start having offsprings with your relatives, then there is a higher chance of any mutation that results in any disease getting propagated through these offsprings. Because if two different people have an offspring and one has some kind of genetic disease, another might not have it, and then the chance of this genetic disease propagating is way lower.
And so that's one problem. So, you know, there is like any breed of dogs, especially if these breed of dogs have been popular within the last 25 years, they come with a genetic burden because of inbreeding. Yes, so you have the hip dysplasia, you have the syringomyelia, you have like Cavalier King Charles. Pretty much all of them are born with heart defects because they are so inbred. Because this is one thing, but another thing is the breed standard. So, like, you know, all the dogs, the like the cute dogs, you know, the French bulldogs, the bulldogs, the pugs, you know, they are bred to have a face and a nose and a throat and windpipe to make it pretty much impossible for them to breathe. So we vets, we need to correct the nostrils, we need to correct the soft palate, we need to correct the larynx, you know, to try and allow these poor dogs to breathe, which is absolutely crazy. Like, this is crazy. And, you know, like, this situation is so bad that even some breeders took it upon themselves to stop breeding these dogs because they're so ill. You know, so there are breed of dogs that are so inbred that they cannot reproduce naturally. So, yeah, this is absolutely insane, you know. Hence, like, I have a crossbreed, and I'm just like, I will never ever take a pedigree dog or a cat because it's just like, you know, they're not healthy. Yeah, but then again, it's the whole kind of like that all is a part, you know, consequence of the whole lifestyle nowadays that, you know, people don't want things that are functional or pets that are functional. People want things that symbolizes their status, yes. So they will get a pet because, I don't know, some celebrity have these pets, so now it's the trendy thing to have. Like back in the day, dogs were, you know, they were obviously pets, but they were like, they had a purpose, yes. So they were for, I don't know, dealing with rat population or for hunting, or, you know, they were working types dogs, so they had to be healthy because nobody will you know, nobody will have like a border collie, like a shepherd dog that cannot breathe. But nowadays it doesn't seem to be that important. So yeah,
as long as it looks fine,
as long as it looks fine, you know, and you can put a cute picture on social media and everything goes like, you know, it doesn't matter.
In your experience, how is the situation with, let's say, various incidents, accidents with pets? I'm asking because it is one of the things that can drive insurance prices up. Because, for example, if you have a big country and one dog gets hit by a car, then and the price of that treatment gets spread across the whole country, it's not noticeable. But if in the same country, like half of the dogs get hit off by cars, then it's going to drive prices of treatment cost for every dog owner up, and that would drive insurance up and such. I don't know if that's something that increases prices in the UK for the insurance, but just wondering if there was...
You know what, I'm going to look it up because what I know for sure that the ownership of dogs increased significantly in UK, and ownership of cars as well. So presumably, if there is more cars and there is more dogs, give me a second. How? I don't even know. Yeah, it's like increasing by like 6 points in the States, the dog ownership.
So the percentage of...
In UK, 12%, so even more. So if you have more pets and more cats, more cars, sorry, then I suppose it will be more common for a dog to be hit by car. And that is nothing because like there is definitely more cats as well. So, and they go out and then they get hit by a car as well. So, yeah.
It's just then, if there is such a component to the rising price of the insurance, then it cannot be solved by financial means or by veterinarians. It's something environmental and has to be solved in that way, though it's not clear how to do that. Was just wondering.
Yeah, you see this because like I don't think that there is because like the problems that vets have, it's kind of just reflecting on the problems that the society has. Yeah, so we have completely unsustainable way of working. Yes, so you are expected to work until you die and then work some more, I suppose. Yeah, then you have people being told that their value is defined by the things that they have, which kind of gets lumped up with the dogs that they have. So they want to feel better about themselves, so they get themselves this pug without even knowing that it'll cost them so much to have a dog. Yes, and then for some reason I just there is a problem of. I hope I'm not going to offend anyone with it, but there is a problem of lack of personal responsibility. I don't think that people are taught to take personal responsibility for themselves and plan ahead. There's this thing that it'll be fine, somebody will be there to catch me. I don't know why. So then when they find themselves in a situation where because I mean in UK UK is actually to be honest, I think that there is more socialistic country than Poland under communism ever was. Because there is just so much benefits. The social kind of benefit system is so it's entirely possible that people might not realize that, if things go wrong, they might actually have to do something about it. There's not going to be someone to sort it out for them. And again, I really don't say it in a way to offend anyone, but this is what I'm seeing. We have at the vets, we have people coming in and being surprised that they have to pay for veterinary services.
That's interesting.
I know. I completely don't get it, but they generally seem surprised that they have to pay. And they cannot pay tomorrow, for example, or in a week time. I don't know why. I mean, would you go to Tesco and say, I take my shopping now and then pay tomorrow?
I'm not as familiar with
Tesco, to a shop, to a shop.
Tesco,
I just don't get it, but I see it all the time at the veterinary practice. I don't know why.
My understanding is that the NHS, the healthcare system in the UK...
Yeah, it's for free at the point of contact, yes. I mean, you do have to, because you are taking money off your salary for the national health insurance, but at the point of contact is free, so maybe they think, but there is no NHS for animals.
So people just assume that since healthcare is free for them, it's supposed to be the same for the animals.
Could be.
Okay.
Could be. So maybe they're just not used to thinking about the cost. I just don't know. But yeah, the kind of taking responsibility for like responsible pet ownership, it's a problem. It's a problem. Yeah.
Talking about education of people and them not being familiar with a lot of things, it's not related to pets in Ukraine, but at some point a certain doctor became very prominent in, did I say UK or Ukraine? In Ukraine, one doctor became very prominent when I believe it was some SARS epidemic or something like this in the world, and there was borderline panic in Ukraine because nobody knew what was coming and how it was going to be treated, and the government was either because of lack of knowledge or because they were trying to use this crisis to score some political points. They were scaring people even more, and it was becoming totally ridiculous. And then one doctor appeared on TV and basically told very simple things, how to treat basically cold, flu and such. And it was something like 2009, I believe. I might be wrong, but around that time. And it was the first time I've ever heard someone saying that you do not use antibiotics to treat flu or cold. It was pretty common in my childhood to get antibiotics for that.
Yeah.
And later, the doctor, Dr. Komarovsky, he has a lot of books now. He's pediatrician and focuses on children, but he also had a huge series of videos on TV and now on the internet about dealing with different regular cases like regular trauma, some bites by animals, some kind of wounds, some common diseases and such. He basically tries to educate, first of all, parents of children, but also the population as a whole. Tries to tell them some basics of medical like healthcare, what you are supposed to do, what you are not supposed to do. He's not trying to make people doctors, but having some kind of education in such a topic that is very relevant to your life is useful, because then you are better prepared for the life. Would something like that for dealing with pets, for having pets, would be useful in the UK from your perspective? And is there some kind of resource that educates pet owners of what to look for? For example, the regular theme in the videos by this doctor is that I'm not supposed you to, it's awesome if you are able to go to your doctor every time your child coughs, but it's impossible, and we understand that neither you are going to do that, and if you start doing that, then doctors are going to be overwhelmed. So here are things to look for. If it gets to these things, like some types of bleeding, some types of rash, some types of combination of some symptoms, this is where you definitely have to go to doctor without waiting and such. Would something like this be useful for pet owners? You mentioned people considering some weird behavior by animals as fits and such. Would some kind of education, like if you see this specific behavior or such specific symptoms in your pets, you have to go to a veterinarian. You cannot just ignore this because it might mean something bad. And then you have to keep in mind that when you feed these pets and when you spend time with these pets, these specific things are important for the health of these pets and such. Is there some such resource in the UK? Would it be helpful?
There is. It's called Google. And now the biggest problem in veterinary medicine is the the false negatives. Yeah, so you will have to find a vet who, and now we get licensed to be vets. Yes, so if I give you a veterinary advice, I take responsibility for my veterinary advice. And if you follow my advice and there is a bad outcome out of it, it's my fault. Okay? So you will have to have a vet who is willing to go on television or whatever and to say, to explain to people that their dogs who can talk, cannot say, I have shortness of breath or my chest hurts. Yes. So you have to explain to the non-clinically trained people how to interpret symptoms of a dog, and I don't think there's anyone that's willing to do that. There is some quite a lot of organization that will like individuals, nurses and vets who will teach the owners first aid for the dog. Yes, so in case of bee sting and stuff like that. But as far as, for example, I am not brave enough to tell anyone, oh, if your dog is coughing this way, it's okay, and if it's coughing that way, it's not okay, because, it's just not responsible advice, because there's a lot of things in veterinary medicine that it's not really easy to describe in words. Basically, unless obviously you've been trained to know that this word means this and that word means that. Like veterinary industry, the whole, especially the small animals, is a huge business, and a lot of people are trying to get a chunk of it. There's a lot of, because of the cost of or sometimes the inability to go to the vets. There's a lot of companies that will sell all sorts of remedies that are supposed to solve your dog's problems, skin issues or diarrhea or something like that.
And they do not.
Well, there is this, how is it, the return to the mean? How is it called in English? Like when you have an abnormality like a disease, sooner or later it will go back to the mean. Yes, so I'm sure that some dogs will improve when you use this remedy, but whether it's the remedy improving the condition or just basically the time, I don't know, because nobody studies these remedies. They not licensed. They not like sold as medicine. Mm-hmm. Because we vets are allowed to sell medicines that are tested. If something's not tested, you can go and sell it all you want. As a food supplement, not medicine. You just call it food supplement, not medicine. Yeah.
Talking about vet responsibilities, another big topic in these lectures by this Dr. Komarovsky in Ukraine is that, unfortunately, because there is so much responsibility being on doctors. Doctors are reluctant to tell you that what you see, that you observe in your child is normal and is going to improve. Yeah. Like when a child has high temperature, fever, flu, you can tell parents that they should go home and just make sure that there is enough air, that it is cool enough, humid enough, and the child is able to drink enough, and then it's going to improve in 3 days, in 5 days, and so on. Because if you tell that and something goes wrong, and there is always a chance that something goes wrong, then you are going to be responsible for that. Which results in, maybe not in cases of flu, but as an example, doctors basically putting some patients into hospitals simply as a precaution, because it's now their responsibility.
Yeah.
And you cannot just hold someone in a hospital without doing anything, like
So you put them on
holding
floors,
someone
yeah.
under observation. So you have to perform some kind of stuff with those patients, and people start getting some IVs, they start getting some kind of injections, and it was, I'm
And
not
you
sure.
might as well run a blood test if they dare, because
Well,
why not?
the blood test is probably one of the most humane things.
Yeah,
but,
that's done, yeah.
Basically, when back when I was a kid in something like 1990, and I had appendicitis, like inflammation.
Appendicitis?
Yeah,
Yeah.
and I was in a hospital. Basically, I had to take, I don't remember if it was 3 or 4 times a day, these injections in my ass with antibiotics and such,
Yeah.
which, as far as I understand, nowadays it's considered to be not necessary to do injections, that you can just use pills and such,
Yes,
and especially for kids. But doctors have to prescribe such treatments, because if they don't prescribe anything and something goes wrong, they are going to be responsible. And if they even start taking care of some patient but do not do anything and just observe, they will be seen as not doing anything useful. Is there something like this in the UK as well?
I mean, now, first of all, in UK, when I, like in Poland, and I don't, like in Poland, you cannot really just walk around suing people. You know, it's not that easy to sue people. While over here, you can get sued, you can get reported to Royal College. There's a lot of things that can be done to you if anyone perceives that you didn't do a good enough job. So it's, I mean, you know, I have heard an opinion, it might be a little bit like over the top, but it's not really far from reality, that if you are a vet, it's not really a matter of if you get sued by the owner, it's a matter of when. And again, it goes back to how, we have to deal with, vets will have, we have to deal with difficult situation where people are on the, the worst day of their life, maybe not the worst, but like the second or the third worst of the day of their life. The emotions run high, everyone is stressed out, tired, overworked, on hours on the veterinary side at least. Things are said, things are done that not necessarily ideal, but then the kind of, we are held, like veterinary professionals, we are held to such a high standard that, and we are only humans, we are only humans. And I got sued once for doing, like, I didn't do anything wrong. Like, the whole case ended up being dismissed, but it wasn't pleasant to be put through the, through the whole process. So, yeah, and you have on one side risk of being accused of negligence or whatever, then, you do a test.
In such cases, does it fall totally on you to defend yourself and to take all the burden, or is it the clinic that helps you?
Yeah.
Because I assume that the risk of such.
Yeah, we all have to be insured. We all have to be insured. So it's either the practice that provides us with the indemnity insurance, or we are ourselves purchasing it. But you cannot practice veterinary medicine without being insured, because things like that happen.
Is it insurance just for the cost of defending yourself, or is it something else? I'm just asking because I mentioned that the risk of such legal cases is basically some kind of professional risk in in vet clinics and such, like for a farmer, a risk of rain is a risk of doing business in that area. And you just have to take this into account and accept that sometimes weather is going to be bad and you're going to lose money. And I would assume that in case of vet clinics, it's also supposed to be the case that you just accept that sometimes you're going to go through some struggle and lose some money and have some problems simply because the way the world is the way it is. But it's one thing if businesses understand that and they accept it as risks and they have some kind of resources to deal with these risks. And it's way easier to have some kind of lawyer for a clinic than each veterinarian having to get own lawyer to defend against such cases. So it's a matter of whether clinics participate in such cases and help take some burden from you, or is it that you have to fend for yourself totally by yourself?
I mean, now how it looks like you know, there is this, I think, and now I am actually not sure because there might be another kind of company that provides this service, but pretty much every single practice I work for, every single vet I work with, and when I had my own company, I was insured also with this one company that's called Veterinary Defense Society, and you pay them a fee, and then you get a certain kind of layer or like level of insurance. So they will cover you up to so much in cost of lawyers, in cost of, how is it called? What's the name? When you like paying out for the damages to the, you know, for you know, whatever mistake you've made. So this is kind of just included in you know, the cost of the business. And I mean, you will have to be crazy to not to have the insurance. And again, as far as I know, the only company that I know it's provide this sort of services in UK, it's called Veterinary Defense Society, and they are amazing. They are amazing. Yes, I had to deal with them when I got sued, and they were just amazing. However, you know, it's not, obviously, understand you have more analytical mind and more like clinical approach to things, but you've got to also look at the psychological cost of that. So for many years, until I actually went into therapy and my whole life became better, but for many years I would just be so terrified of getting sued or having a complaint that, you know, at times it was absolutely paralyzing fear. So nothing really was happening, and I was already just worrying that, you know, or you will have a difficult case, you know, where you don't have a lot of time to make decision. The decision is life or death decision, and you can absolutely get paralyzed for that. And it has absolutely, you cannot really make it part of the system. This is like a human factor here, okay? I have seen vets absolutely just falling apart, even if the owner, and you know, unfortunately, owners, sometimes they frustrated, sometimes they angry, they don't understand, and they will, you know, tell us, oh yeah, I see you in court and things like that. And again, human factor, not much you can do about it. And I have seen vets absolutely just breaking, just from nothing even happened, you know. They just heard the words and just completely falling apart. So yeah, it's not only the cost of it, like in terms of money and time, but the cost of it in terms of just psychological stress, I suppose, that you have to go through with. And to be honest, I mean, I don't know. I don't know if I think that vets, there's got to be some ways to prepare vets better for that. There has got to. I refuse to say that there isn't. You know, Yes, I have to pay from my own pocket for therapy. That kind of a part of sorting me out gave me tools to deal with that. And, you know, so I know you can be given like tools, psychological tools to deal with this sort of stress. There's got to be a way to make it part of veterinary training. There's got to be, and nobody's doing that.
That was going to be my next question, whether it was kind of part of your education that are you able to at least get some kind of consultations from this veterinarian organization that helps you with these cases? Do they just provide money, or do they just do they also provide some kind of advices, consultations for you to know how it happens, what to expect, what kind of help is going to be there? Because I assume that it would be at least somehow helpful psychologically.
Yeah, you are the Veterinary Defense Society. You can pretty much call them with everything. And there are vets working, not only lawyers, but there are vets working there as well. So, you know, you do get support. If you're lucky, there will be a vet on the shift with you who will take, you know, pause everything and just give you time to put yourself together. But it really depends, because I might as well be that you just have to put yourself together and go back to work, because otherwise your manager will be on your head while you're not working. Why are you falling apart? Why are you crying here in the corner? What's wrong with you? It's full waiting room.
And before someone thinks that there are stronger vets and weaker vets, and maybe it's a problem of weaker vets so that they break down like this, it's just that state changes over time, and at some point you are strong, and another one you are out of your energy resources and such. And when you have multiple people working together and they are on different points of these waves, then someone who is in the moment feels way better, has more energy and strength, can intervene and help those that are out of their strength.
You see, but also, you know, like in the very, very important part of resilience is you can be one day you can be the most resilient person on the whole planet, and another day the smallest thing will break you. Okay, so this is one thing. It's not a function of a person. It's also a function of your
I totally
whole.
agree.
Yes. But there's also, you know, because like you have to go back to you know, who are vets. You know, we are overachievers. We are, you know, in order to overachieve, we are used to having control. Yeah. So you control the rate at what you study, when you study, how you study. You know, you have to plan ahead with your, you know, grades. With you know, then you become a vet and you control, you know, the drug you give, the dose you give, you know, when you give, you know, how you give, and then suddenly you find yourself absolutely out of control. So it's a function also of the ability, like, you know, a very important part of psychological resistance is the ability to say, to just let it go, you know, and say whatever will be, and that is not easy, and nobody teaches us that. So if you're lucky enough that you have a vet to have enough, like, you know, more experienced vet to have enough presence of mind to tell you, you know, to like walk you through the narration in your head that you have to tell, the things that you have to tell yourself to find peace, to walk yourself back to the point where you feel like you're not panicking, then you're good. But if you don't have anyone to walk you through all of that, and you didn't have any training in kind of, you know, like maintaining internal peace and being able to like deal with things on a psychological level, is not easy. And, you know, like from what I'm seeing, people are not born with that. Someone has to teach you how to do it.
That you cannot solve all the problems in the world,
yes.
And you have to solve something, but let others go.
Yes, and also you have to just say, you know, trust yourself as well. just like whatever will be, I'll be fine. And that's hard. Saying something like that is very, very hard. Yeah.
You mentioned at the very beginning that when you were starting, you were a vet technician.
Mm-hmm.
And you were a vet technician while studying. Was it some kind of different preparation? Because it's usually helpful when someone tries to go into some kind of profession,
Mm-hmm.
to have something that doesn't require a lot of effort, some kind of entry-level mean to experience that profession and to
Mm-hmm.
check whether that profession suits you.
Mm-hmm.
So how hard it is to become a vet technician? How long does it take to get to be trained in that? And how much are you able to learn about how vets work and what this job is about while being a vet technician?
So now, I don't know how you become a vet technician from my own experience, because I became vet technician because I went to a practice and I said, I'm going to be a veterinary student, let me work with you. And they let me work with them, and then they just told me whatever I had to do, I was doing it. Scrubbing, kits like the surgical tools, cleaning floors, walking dogs in the hospital, and you just keep building up. You can absolutely qualify to be a vet technician, and I think there are colleges for that in UK. I want to say it's 2 years or 3, and then in UK you don't have it's not called vet technician, it's called veterinary nurse. I think they have vet technician in the States, and you can absolutely, these are practical skills like collecting blood samples, sterilizing surgical tools, assisting in surgery, like operating, anesthetic machine, checking blood pressure, running, samples in the lab, because, these sort of things. And now, kind of sometimes it's funny, I was kind of smiling a little bit when you were asking question, because I kind of got, sometimes I just tell myself I got duped into veterinary medicine, because when the practice that I work for when I was studying, when I worked for as a technician, when I was studying to be a vet, they were awesome. They were just absolutely awesome. It was a really tight team. Everyone was like helping each other, and the atmosphere was absolutely amazing. And I just thought this is how it always looks, and it built that. I think I'm actually maybe a couple of weeks ago, I was having the same conversation with my coworker, that it just build my expectations to an unachievable level, and I've been chasing the dragon ever since, trying to get back into a team as good as this first practice was. I don't know. As far as me working as a technician while studying to be a vet, I think is the best possible way of becoming a vet. I truly believe that every vet should compulsory work as a nurse for at least 6 months, because the fact that vets don't appreciate nurses or technicians is another big problem of veterinary medicine, and it makes me so angry when I hear, these vets who are convinced, they convinced that it's thanks to them that the whole practice is functioning, while really, they are important, but the nurses are as important, the receptionists are as important, everyone puts in their bit. And also, there's a lot of ways in which vets can make the job of nurses and receptionists easier, which don't really cost us anything, after surgery you take your sharps out and you get rid of them, so the nurse doesn't have to cut herself when she's cleaning the kit, really easy thing that costs us nothing. Vets don't see it because they never had to do it. So I think absolutely every single vet should compulsory work as a technician or a nurse for at least 6 months. But again, whether it prepares you, it definitely prepares you to your clinical role, but whether it prepares you to the work, the other aspect of veterinary medicine, it really depends on
Sure.
where you work, really, because there are some places that are horrendous, and some that are amazing. So again, back to the human factor. Yeah.
Thank you. I already took more of your time than I promised to, but it was a very interesting conversation.
It's absolutely a pleasure.
I will most probably get more questions after I think about it for some time, and maybe we have another chat later. But I want to thank you for this opportunity.
No problem at all.
Have a nice day.
No problem at all. Bye.